Welcome to Healthbeat, the show that takes the pulse of South Africa's healthcare system. I'm Mia Malan. April 2022, KwaZulu-Natal. 500 people are left dead after the worst floods in the province's history. But beyond the headlines, what is the hidden mental toll?
We've got multiple first responders from various rescue organizations who have arrived here in Pinetown, and this is only the beginning. The main deluge of rain will start tonight just after midnight.
When massive rainfall hit South Africa's east coast, rivers flooded and tons of earth slid downhill.
On a Monday evening in early April, just after 6, a warning came through to marshal security in Durban North. Journalist Andreas Matios leads their video response team.
So the warning is normally given to us from the South African Weather Service, which gets sent through on WhatsApp. When we get a level 5, it's a lot of rain, a lot of wind, and the volume is very important. What we call a mother of all storms.
20 kilometers inland in the Palmet River Valley on Durban's outskirts, communications consultant Charlene Versveld was on edge after days of rain.
It just was constant, so there was no actual major moment where water came down. We've seen that before on other occasions when up the river there has been a sort of outburst of rain, but there was no actual warning that this thing was going to actually do the damage that it did. We were kind of locked in the house and watched this river just rise and rise and rise and rise.
By dawn on Tuesday, more rain had fallen in a few days than normally fell in a month.
On the Tuesday morning, when we had slept through this constant rain, we woke up and then it was just mayhem. The damage was just unbelievable in this area. Because we're well resourced, we are more privileged, we still had access to communications and WhatsApps and all that kind of stuff. So there were people constantly in communication with each other. But the reality of it, when you woke up and you saw what was going on, we woke up and I looked out the window and I said to my husband, the car's gone.
It hit the Durban Central, the Durban North areas quite extensively, all the way up to Belita. And the areas around Lelucia, the motorways, the M4 freeway was completely flooded at one point. Cars were actually driving under the bridge. And because of the poor drainage system, water wasn't running off. We had cars getting stuck. There were reports coming through that there's embankments that have collapsed. One of the challenges that we had was we didn't have enough people and resources because all of a sudden everybody had run to one point to deal with what was happening in front of them.
Days without sleep turned into months of cleanup, with more than 40,000 people displaced, livelihoods, communities erased.
We went into the valley behind Tongaat, and as I came over the hill, I said to myself, I cannot believe what I'm actually seeing. I normally, after a long day, and I was pushing 15, 16 hours at one stage, I think I was pushing 36 hours. My mental state of mind was starting to take a bit of a knock because, as a journalist, you get to see a lot of things. We go to suicides, we go to shootings, we go to murders, but nothing affects you quite like something that's still living and it's destroyed someone's home, someone's livelihood.
This is climate change. More intense storms, faster, deadlier floods, heat waves that kill. This isn't the future, it's already here. The pictures tell the story, and in Durban, more than 3 years later, the scars are still there, especially for those who lived through it.
KZN is going to be declared as a provincial area of disaster so that kungene imithetho ezasivumela so that we are able to do things quickly. The bridges have collapsed, the roads have collapsed, people have died, people are injured. So this is a catastrophe of enormous proportions.
We're at the Africa Health Research Institute in Durban, where Collins Iwuji and his team are calculating the invisible costs of climate disasters. Because what we don't measure, we can't fix. Collins, thanks so much for your time today. You are a HIV doctor and an epidemiologist, and now you're doing mental health research. Those are two very different things. What brought you here?
Well, thank you, Mia, for having me. So in 2014, I was involved in an HIV research that was offering HIV testing to people in their homes and referring those that tested positive to the clinics. I observed that people weren't going to the clinic as we expected them to, and one of the reasons was because we were identifying them earlier in the course of the infection. So most of them felt well, but something else was happening at the time. KwaZulu-Natal was experiencing one of the worst droughts ever recorded in its history. So driving home, I saw long queues of people waiting for water, dead cows, and I wondered if that had anything to do with the people's inability to go to the clinic, and I thought it might be something that was worth looking into.
So there was a drought, people had to look to survive rather than going for their HIV medication. How do you think that co-played together?
People had to make trade-offs between going to the clinics, spending the whole day trying to get their treatment, or attending to other life necessities, and it was a difficult trade-off, and some dropped out of care altogether. We investigated that formally and identified that indeed drought was impacting people's ability to take their treatment. Food security was an issue. People didn't want to take their medications on an empty stomach.
So after the droughts, there were floods, and that must have a similar effect on people's mental health. And that's what your research is about, right?
So this research then formed the basis for further inquiries. And one of the issues that the community raised was how climate change was impacting their mental health. So following the catastrophic floods in 2022, we saw that as an opportunity to actually talk to people and document how this might be affecting their mental health and what solutions that we could work together to mitigate the issue. Some people following a flooding event had water go into their homes. Some were temporarily displaced from their homes, while others were unaffected, living in more secure and safer housing.
And you then compare the depression, anxiety, and PTSD levels of the unaffected households to the ones that have experienced flooding consequences.
Yes, having these comparisons allows us to estimate this excess risk as a result of the flooding event, especially in South Africa where adversity is quite high. So people already have depression, anxiety, and post-traumatic stress disorder for a variety of reasons.
Collins, in Africa, you don't often come across studies that look at mental health impacts of climate disasters. Why is that?
The cultural interpretation of mental health in the African culture is different. Most mental health symptoms are probably attributed to some other causes other than mental health. So collectively, all these things delay investigations into mental health. But now it's starting to gain attention and people are starting to look into it.
How do you study the mental health fallout of climate change without understanding how local communities define depression and anxiety? More from Collins and his team after the break. You're back with Healthbeat. What do we know about how climate change affects the state of mind of people in Africa? Just about nothing. That's where WEMA comes in. They're looking at exactly this in 4 African countries.
In South Africa, the scientists chose Embo, 50 kilometers southwest of Durban, near the Umzimkhulu River. Dr. Sthembiso Ndlovu, born and raised in KwaZulu-Natal, has come to know the area better than he ever expected.
I don't know if I could classify it as rural. At the same time, it also has this township feel to it. We first started with the inception meeting, where we meet with about 25 potential participants, and then we screen them, and then we trim it down to 10. The screening process looked heavily on their motivations for wanting to be a part of the project. One of the main things that stood out for me was the fact that they received no mental health support. We saw that as a cry for help.
Senior Comms Officer Ruth Mtembu had to explain the scientists' plan to people who'd been through hell.
You know, what was great about it was to have people join a project where there would be co-creators in the research. So it goes from being research on people to it being research by people and for people. So looking at how your lived experience is just as valuable and important as the academic training.
Ntokozo Ncwane and 9 others from her valley became co-researchers, spending a week with the scientists, drawing and speaking about what they'd been through.
I started shouting for my brother, Sanele, Sanele. I heard him reply, Ntokozo, where are you? I then realized he was also looking for me. I replied, I'm on the road, and asked him, are you okay? He replied loudly, yes, I'm okay. I felt relieved after hearing he was okay from the sound of his voice. Then I started shouting for my father, Baba, Baba, so many times, but I had no reply. Then I saw him from a distance walking with a neighbor, and I was relieved.
The next day, how were you feeling emotionally and mentally at the time?
It was very, very hard because we were here, we were trying to clean everything because even the roof was in here, the cars were damaged here.
For many of them, they hadn't really spoken about what had happened to them. It speaks to trust because it's very difficult to speak of a traumatic experience to people you've just met.
Across the valley, digital story making pushed Nonhlanhla Mtembu on many different levels.
Simo sezulu sasingesihle, lalinomoya omkhulu, lina imvula enamandla.
Bengithi mangikhuluma lento ngivele ngikhali. Okwabanzima ukudweba. Hayi angikaze ke ngidwebe. Hayi ngangize ngempela hayi. Lokhu siyixoxa lento siyiphinda phinjwa nalamanje siyixoxa sekuze kwangiphila sengigudi. Njengoba nibona izitini, lokhu kwenzeka lonto abantu bangisiza bangibuyiselela. So ngiyasaba ukuthi njalo uma kunomoya ukuthi izophinda futhi iphephuke.
I needed to go through all the 10 transcripts and then analyze each and every one of them, see the commonalities that came up. For instance, 6 people or 6 community-based co-researchers mentioned our house was damaged, my room cracked, the walls fell. And then we see now if that also came up in Kenya.
For us in the core WEMA team, we're looking at interventions that are national. So from a policy-making point of view, that what can be put into law that can help with better responses when an extreme weather event hits, what proactive steps can be taken. But at the end of the day, we're really trying to seek what interventions could work from a local level.
Now it's up to the scientists to share these community solutions with policymakers and global audiences.
We've sent climate change and mental health abroad, but now bringing to communities where there are less resources, there's a high unemployment rate, and trying to find ways to deal with the situation with the little that they have, I think for me would be a cherry on top.
After the break, flood survivors and post-traumatic stress. Durban, Kenya, Mozambique, Burkina Faso. Thousands of people have been displaced by floods. But what does that kind of disaster do to people's mental health and the mental health of the researchers who work with them?
When I noticed that our yard was covered with soil, my neighbor's stuff like building blocks, Jojo tanks, neighbor's tombstone was stuck on our fence. I looked at the neighbor's house and I noticed that the whole main house was washed away.
Let's get back to the digital storytelling. So when you have this process where people share very traumatic experiences, it helps you in your research, but is it not a form of therapy for them as well because they have so little access to mental health services?
On the one hand, yes, it can be a form of sort of catharsis, in terms of having someone to talk to. On the other hand, we need to be careful not to re-traumatize them by having them go through their experience all over again. So that's why during these digital story sessions, we have psychologists present in the room to provide counseling and support so that if anyone is distressed as a result of telling their stories, they get instant support and, if required, further referral for psychological input.
And your researchers, when they hear those traumatic stories repeatedly, how do they cope?
I was in Kenya in the field with field workers collecting data, and we had to meet with them once a week to debrief and provide any additional support required. Because when you hear this story of adversity over and over again, it starts to affect you.
I was so confused. Then I remembered my chickens were in the coop. I went to check on them. Most of them had already drowned. I felt very bad. That was a loss to me. I had to wait for my children to reach home, which was hard. They had to stay at Mama Brayo's house for about 3 hours until the water went down, and it was already dark.
You went into Nairobi yourself with the data collection, and what did you see?
Yeah, what I saw was really heartbreaking. I saw the dire conditions in which people were living, especially in informal settlements in Nairobi. It was difficult. People living in like flooded rooms, sewage flowing through where people were living. It was a difficult place to be.
Collins, you've had early results in Kenya. What do they tell you?
We've just recently completed the prevalence survey over there, and early findings show that the prevalence of post-traumatic stress disorder amongst exposed communities was 44%, whilst it was 30% in the unexposed communities. What that means is that flooding might be driving a higher prevalence of post-traumatic stress disorder.
Collins, all the research shows us that floods and droughts are just going to become more common. So we're going to see more of these mental health consequences, and we need to plan for that.
Yes, South Africa has very strong scientific capacity to respond, has clear climate policies in place, but the challenge is turning those plans into action on the ground, like protecting water supplies, supporting farmers, strengthening health system resilience, making sure that adaptation measures reach communities before extreme weather events push them into crisis. So if you take floods, for example, those that are disproportionately affected are people living in low-lying or informal areas who are poor and have fewer resources to adapt to the impacts of climate change. For these people, it shouldn't just be about infrastructure protection. It should go beyond that to protect mental health and well-being. The floods are also associated with other physical health conditions such as increases in waterborne diseases, respiratory illness due to dampness from homes, and other physical health problems.
So if people live in a low-lying area and they're very vulnerable to floods, do we move them or do we build things around them?
Moving them, of course, will be the best thing, okay, to more secure areas away from floodplains. But sometimes it's difficult to move people, so creating good drainage systems so that during heavy rainfalls, water can actually flow away from those areas rather than accumulate and cause damage, is one way to address that. Another way is early warning and response system. So making the information available to people, saying like in 2 or 3 days' time, there's going to be heavy rainfall, there might be flooding, and the impact is going to be amber or red or green, because South Africa has an impact-based weather forecast system. You also tell them what they need to do to respond, because it's not enough to say there's going to be a flooding event. What should people do? People need to know what to do so that they can protect themselves.
So we're more vulnerable here in Africa, but we've got less money to adjust or to adapt and protect ourselves against climate change. And that's not very different when it comes to mental health. Mental health is always the smallest part of a budget, and the kind of services we have available, even without climate disasters, in our public sector, that's really limited.
South Africa probably has about 1.5 psychiatrists per 100,000 of the population. So it's difficult to expect the few psychiatrists that we have to address all the issues that we'll be experiencing with mental health disorders. So one way will be tax shifting or tax sharing, training community health workers who live within the communities. A lot of studies have shown that those who are more likely to recover quicker from the effects of trauma are those who have social support, either from families, friends, the church. But the stronger your social network, the more likely you are to recover quicker from the effects of extreme weather.
Absolute no-go. Nobody to go through here.
This disaster is part of climate change. It is here, and our disaster management capability needs to be at a higher level.
Collins, if you were to sit in front of a policymaker who makes decisions about policy in a country, and they tell you, but mental health interventions are just too expensive to invest in, what would you tell them?
I would say to them, mental health disorders affect the most productive people in the economy. So an investment in mental health is an investment in the economy. We're going to present all the results we've generated in workshops with them and then brainstorm solutions. Having them involved right from the outset will make sure that the interventions we're developing are feasible and something that they are interested in. In the past, when researchers have developed interventions and taken those to government, they've only discovered that it might not be what is required at the time, or not feasible to implement, or even unaffordable. So we don't want to make that mistake, which is why we're involving them right from the outset.
That's it for this month's Health Beat. We want to hear from you. What has your weather experience been like? Let us know your thoughts at health@bekasisa.org. Thanks for watching.